Good evening, everybody, and welcome to tonight's webinar. My name is Bruce Stevenson, and I have the honor and privilege of chairing tonight's webinar. As it's a members webinar, I don't think I need to do too much housekeeping. Remember to use the Q&A box to drop any questions, and we will get to as many of those as we can at the end. If we don't, we'll pass them on to Margie and ask her pretty please to help us and answer as many as what we can. So it is my privilege tonight to introduce Dr. Margie Shirk. Margie graduated from Ontario Veterinary College in 1982. In 1986, she opened Cats Only Veterinary Clinic in Vancouver in Canada. This was the third feline clinic in North America. She became a board-certified feline specialist the first year the specialty became available and has maintained her certification ever since. Since 2008, she has been a consultant and an educator speaker, speaking internationally and teaching online. Margie has co-edited the Journal of Feline Medicine and Surgery for 23 years. She has served extensively in the American Association of Feline Practitioners, as well as other veterinary organizations. Margie, welcome to the webinar, Vet, and it's over to you.
Thank you, Bruce. It's a pleasure to be here. I'm looking forward to talking about a variety of gastroenteric syndromes in cats. And of course, there are many, many. As a consequence, while I have selected a few here, I won't even make it through all of these. So I apologize for that ahead of time. I really wanted to teach placing an esophagostomy tube because that's something that every one of us can do and should be prepared to do on any given day. But I will see what I get to. So without further ado, let me start with what we commonly call inflammatory bowel disease, but that is actually a misnomer. We should be talking about chronic enteropathies, and I'll talk about the progression or supposed progression from IBD to lymphoma, as well as diagnosing small cell lymphoma. So IBD is actually a histopathologic diagnosis. We can't really make the diagnosis any other way. We can't make it by through ultrasound or through the clinical signs or the clinical findings. Chronic enteropathy, on the other hand, is a broader term. It describes a syndrome of diarrhea, vomiting, and weight loss of more than 3 weeks duration. So generally what we're talking about is chronic enteropathy, and it may be during those 3 weeks, it may be intermittent or continuous. Some cats with chronic enteropathy have inflammatory bowel disease or lymphocytic plasmacytic enteropathy, which again is a better term because inflammatory bowel disease tells you nothing. It just tells you there's inflammation in the bowel. It doesn't tell you anything whatsoever about the etiology or therefore how to treat it. Lymphocytic plasmacytic enteritis or enteropathy describes the types of cells that are aggregating, and other cats will have lymphoma or less common causes. So chronic enteropathy or IBD can be food responsive, occasionally antibiotic responsive, but that's generally not where we want to go with it, steroid responsive, or idiopathic and non-responsive. So it is more accurate to refer to chronic enteropathy pending a diagnosis. And what we see with the architectural changes associated with chronicity, be it chronic enteropathy or true lymphocytic plasmacytic enteritis, the lymphocytic plasmacytic form of IBD, of inflammatory disease, is that we see cryptal edema and blunted villi. So in the image on the left-hand side, you can see the edema in the cryptal area and the blunted villi. It's not strictly the increase in numbers of cells. So that's why you need a biopsy. So the history and differentials, it's chronic, it's non-responsive generally. You've tried diet, you have tried to deworm, you've tried some diets. Weight loss can be dramatic depending on where the changes are present. If they're significant in distribution, lots of it in the small bowel. Stool character varies widely. It may be large or small bowel diarrhea or possibly no diarrhea. They may have a voracious appetite, again, if it's localized in the small bowel. And sometimes they don't use the litter box. So someone may be coming to you because their cat is defecating outside of the box. Otherwise, there's an unremarkable history.